Hi and welcome to India. My name's Priya Shah and I'm going to be your tour guide today as I take you around and show you the amazing things that are happening here at the Jaya Rehab Institute. I'm here volunteering for about a month back in my dad's native homeland of Kutch, India. This area we're located in, Kutch, is in the northwest part of India in the state of Gujarat. It's a very remote and very underprivileged area where there's very little medical care. I want to share with you a little bit about how this place came to be. Every year for the last 36 years, they run a camp where people from all over the world and all different professions come back to work in their native homeland. There was a large earthquake that happened on January 26th, just one day after the camp had ended. It was the largest earthquake to ever hit India in recent history. All the local hospitals were also destroyed. The Trust, seeing the desperation of the people, immediately chartered flights and started bringing medical staff to reopen the camp and medical supplies back from Mumbai. 9 or 10 physical therapists came from Mumbai and worked around the clock. They saw 400 to 500 patients a day. There was really no other medical facilities around, so busloads of people were just being dropped off here to try to get whatever medical care they could. There was an amazing amount of disabilities and disabled people, lots of amputations, lots of spinal cord injuries, lots of people with very multiple traumatic orthopedic injuries, traumatic brain injuries, and really no rehab facilities here to allow for their healing. So in 2001, the Trust really saw a need for them to develop a rehab unit. And under the direction of Mukesh Doshi, they hired Dr. Samuel, the lead physical therapist, and started coming together with the idea of Jaya Rehab. In April 2004, the Jaya Rehab Center opened. And today I'm going to share with you all the things that are happening here in this very remote area. Come with me. Let's take a look. We're going to now tour the outpatient rehabilitation and inpatient rehabilitation facilities. Most of the patients that they see here are going to be orthopedic, neurologic patients, and a full pediatric caseload. So let's go ahead and take a look and see what happens in here. Physical therapy in India at this facility has direct access. You don't need a prescription to see a physical therapist or occupational therapist. Here's some patients lined up. There's treatment areas on both sides of this hallway. So here we see some rehabilitation taking place by Dr. Ashok. This is a patient that has had a stroke. You see the family members also present. It's important here that the family members also come and stay with the patient during their inpatient rehabilitation stay. This is an inpatient who is living here, and he will be living here for 3 months and be receiving physical therapy twice a day. This is an orthopedic case. This patient was involved in a traffic accident in the local area, and she sustained multiple fractures. She's going to be living here inpatient until she's able to get back home and fulfill the obligations of her home. She will again be living here about 3 months or until she's fully functional again. This is the hand function area. We also have an occupational therapist that is on staff full-time. Patients that need help improving their fine motor skills, there's a whole area set up here for hand function. There's nothing to say. This is a patient working on the finger ladder, an independent patient who's recovering from a shoulder injury. This is the pediatric area. Most of our pediatric population we treat here has the diagnosis of cerebral palsy. Many patients in the villages do home birthing, and therefore it's a little bit higher risk, and we have a very high incidence of CP. We also treat a lot of patients with polio in this part of India. It's gotten much better, and there hasn't been any cases in the last 5 years, but there still is also a considerable pediatric polio population. There's therapist Dr. Bhavisha in the middle. She's working with one of our cerebral palsy patients. The family is a very integral part of the rehab. They're given exercises to work on at home, and also they participate fully in all the treatment sessions. So you see there's one therapist for multiple patients, so the family, again, very involved. The therapist will give the family exercises to work on with the patient while she works with another patient. The amount of community and family support that I've seen here in Kutch is far beyond anything I've seen back home in America. Here's an example of a local man that established a crush injury, a fracture of his hand while working. This orthotic on his hand has also been fabricated here, and Dr. Samuel will evaluate his hand and determine what the best course of action is. If physical therapy is indicated, again, we'll do that physical therapy right here. I'm sitting with Shanti Veera. He's one of the trust members here of the Bidra Hospital. And I wanted to ask him a little bit about how the orthotic and prosthetic department is helping the people of India outside just this facility here in the hospital.
Number one, by conducting the seminar on different rehabilitation programs. Number two, we have been visiting, for example, Dev Smruti Trust at Gandhidham, where the rehabilitation of the disabled, all the measurements are being taken by our prosthetic and orthotic department, and the orthotic prosthetics are being delivered by.
Thanks for all your hard work. It's really of great service to the people. Okay. I'm with HP Kubal. He's our prosthetist. Just after the earthquake, he had to make approximately 200 different prostheses. There was many amputation victims from the earthquake. So here's an example of how he's actually fabricating. All of our orthotics and prosthetics are fabricated in-house. So with an amputation patient, first they would take a cast using plaster of Paris of the stump. Once the the cast is made, then they use this cast to create a positive impression using, again, plaster. Everything is made by hand here. So after the earthquake, there was the need to make all these orthotics, so they're all being made in-house. We just finished making the mold out of plaster. Then the mold of the stump is brought over here, where now they're going to start working on the process of fabricating the plastic replica of this mold, which is going to be used as the socket, which is the upper part of the prosthetic. This stump that we have set up right now is for an above-knee amputation, which they're working on. So he just put the stockinette onto the plastic material. Now go ahead and the plastic material is going to go into the kiln. It's going to be heated to about 250 degrees. Once that happens, the plastic is going to be very soft. They're going to bring the plastic back out here and put the plastic on the stump model, and you're going to end up with the cast. So once this second process is complete, you will end up with something like this, which is replicating a thigh, and this is going to be the upper part of the prosthetic device. He's buffing the new socket that we just fabricated. The first one here is the Autobach. This is for a below knee amputation. This is actually the same one. This is earlier on, and then they do the cosmetic covering. This is called an endolite. This is for someone who had their knee also amputated, so they have the mechanical knee here called the endolite knee. This is another AK prosthetic, and here's also an AK prosthetic with the Jaipur foot. There is a small copay for the patient, about 5 or 10%, but in general, the trust covers about 90% of the cost of all of this fabrication, which is very labor intensive. And of course, if the patient is unable to afford it, the trust will cover it completely. This is Jainab. She's a 37-year-old earthquake victim. She was amputated at the age of 28. During the earthquake. Also, her husband expired during the earthquake. She's here getting refitted for a new prosthesis. We've remade her prosthesis here. We're still working on getting it fabricated to a little bit better fit. because she hasn't been walking with a prosthesis for a while. So now we'll hopefully get her into some therapy and get the therapist, the prosthetist, and the patient to form a team where they can all three work together to get her walking properly with her prosthesis. I just want to show you her prosthesis a little bit. This is the prosthesis that Kubo made for her. Here's the knee and the socket that we learned how it was made. So maybe we'll just see how she walks with it on as well. Thank you. Okay, now we see Jainab walking with her prosthesis on. Again, it's all a donated prosthesis, time and effort by the Trust. Much better walking pattern. Over time, if you're not wearing a prosthesis, it starts to put all these abnormal pressures on your body, and you start getting a lot of other premature joint breakdown. So we really do want to get a patient walking with a prosthesis. It's much better to reduce the risk of osteoporosis and all sorts of degenerative changes that'll happen when people continue to not use a prosthesis. And another view of just her walking, you can kind of see her walking from the back and the front at the same time with the mirror. This prosthesis is still brand new to her, only a couple months old, but with her age and her diagnosis, it's very possible and probable that she will be able to walk without a walker. I'm here with Rohit. He's our orthotist, and I'm just going to explain to you a little bit about the process of fabricating orthotics, which again is also done completely in-house here. Similar to the prosthetic devices, they use plaster of Paris to create one of these die casts. Then once he has a die cast, he uses a fiberglass material, heats up the fiberglass, and uses this replica to create what's called an AFO, or ankle foot orthosis. If you can show us here, Rohit, this is called a KFO. This is used with our rehabilitation of stroke patients. So he'll take all the measurements, write them down, and then fabricate this completely, from sewing on the straps to making the knee joint for a patient that had a stroke and is unable to have any muscle function of their affected hemiparetic side. We can apply one of these braces, and once the brace is on, it'll hold the leg stable and allow the patient to walk. A patient that couldn't walk before they have the brace on, once we put one of these braces on, they're able to walk again. So the physical therapist will also work closely with the orthotist to kind of get everything tweaked properly to allow the patient to have the most functional life they can after their stroke. Here's some other examples of orthotics that Rohit has made. This one's pretty interesting. It's a full body brace for a very advanced scoliosis patient. He had to do a full body cast, and now he's doing a fiberglass brace for them. Here's another example of KFOs and a bunch of different kinds of orthotic devices that, again, made completely in-house and free of charge for the patient. It is a private room, but the patient's family is required to stay. We have no nursing staff, so we depend heavily on the family to go get food for the patient, to help the patient with bathing, dressing, and all nursing needs. I'm with Vijay Cheda right now, who's the managing trustee. As far as the daily operations of the hospital, he is the very important facilitator of all the stuff that happens here. We're in the Vocational Training Center, which is another aspect of the Inpatient Rehabilitation Unit. And I'm just going to ask him a little questions about the vocational training and what kind of stuff you guys offer here and afterwards for patients.
This Vocational Training Center has been train the people after the rehabilitation into carpentry, computers knowledge, sewing machines, and plumbings and paintings and other things. So the people can get the train over here, and then they can go back to their own town and they can earn their livings. And we thank you for supporting, and we continue to get support from United States, UK, and other different countries to continue our works.
Vijay has had a 30-year commitment to this organization, and it's his long hours and hard work that have created a lot of health and well-being in this community. So thank you so much for your hard work.
Thank you.